Good morning, everyone, and thank you for joining us today for the opposition press conference. As you know, every Sunday we try to have this press conference so that we can have a discussion with the population and raise some pertinent issues that are within the public domain. Today, we want to, of course, focus on the motion that would be brought to the Parliament this week. The government has signaled its intention through a motion to ask for a 3-month extension of the state of emergency, which has been in place since the 15th of May of this year. They have indicated that they find it necessary and expedient to do so. These are the words used in the motion. And we have some particular concerns that we would like to raise. Joining me this morning is a Member of Parliament for Caroni East, Dr. Rishi Sicharan. And I would allow Dr. Sicharan to first raise some of the issues with you from a medical standpoint, and then I would speak later on a couple of other issues.
Thank you very much, Jayanti. Good morning, everyone. I would like to begin by stating that the position of the United National Congress and that of our political leader, Kamla Persad-Bissessar Senior Counsel, is that we do not support the extension of the state of emergency in Trinidad and Tobago. The justifications given to initiate this current state of emergency no longer exists, and there is no need for another 3 months of our country to continue under this draconian measure. So just to put things into perspective, today the editorial of the Sunday Express, they said it best, where they use actual figures to prove this point, that the state of emergency has not been very effective in curtailing the spread of the coronavirus. On May the 15th of 2021, we had 276 COVID-19 deaths in Trinidad and Tobago, as well as we had 15,000 cases, positive cases of the coronavirus. Today, 3 months after, we have 1,219 deaths and over 42,000 cases. So the state of emergency has not curtailed the spread of the coronavirus to a great extent. Some of the measures that the Attorney General is asking that is needed to be done under the state of emergency, such as the use of dental interns and medical interns to help vaccinate the population, can be done under a normal public health ordinance. So what we are saying is, what is the need for the state of emergency for another 3 months that has not worked? I will make my point today using 6 examples. Firstly, cases and deaths. 3 months ago, on the 15th of May, Dr. Keith Rowley announced that Trinidad and Tobago would be placed under a state of emergency for an initial period of 3 months. He also added that a curfew would be in place from the period of 9 p.m. to 5 a.m. in the morning. The reasons that he gave was to ensure that people had fewer opportunities to congregate and to spread the coronavirus. Now, in the first 2 weeks of May of 2021, when this was put into place, there were 107 deaths from COVID-19 and over 5,000 new cases. The rolling 7-day average for COVID-19 was almost 400 cases per day, and we were ranked in the top 10 countries in the world with the highest surge of coronavirus. Now, this was in the aftermath of an ill-advised relaxation of restrictions, while less than 1% of our population was fully vaccinated for the coronavirus. The mixing of the population over the Easter weekend between islands and intra-island allowed pockets of infection to spread and multiply quickly in Trinidad and Tobago, and we soon went into widespread community spread of the coronavirus, from which we have not fully recovered. Now, in an attempt to arrest the escalation of deaths, Dr. Rowley himself stated that it was predicted by the Ministry of Health that we would have as much as 100 deaths per day if nothing was done. A state of emergency was implemented along with a curfew in order to flatten the curve. Now, this was done in many countries around the world, as was first done in Wuhan in China at the start of the coronavirus pandemic. While the curve has been flattened to some extent, we are still currently experiencing a 7-day rolling average in the vicinity of 200 new positive COVID-19 cases per day. A continuation of the state of emergency will do nothing to arrest the number of cases per day in the next 3 months. We can only get out of the situation that we are in by vaccinating our population. My second point, it refers to the business community and the opinions of the business community to the state of emergency. Now, Dr. Rowley has said the only difference between a state of emergency is that it takes away people's rights. And he had decided before not to take that action. A significant factor, he said, in changing his mind when he called the state of emergency 3 months ago was the general consensus among the nation's business groups that such a measure was necessary. Dr. Rowley announced one day after the business community called for a state of emergency in May 2021, and he imposed a curfew as well. The move became necessary in light of the high number of cases and the rising death toll in May of 2021, which saw 21 deaths recorded in a single day. Dr. Rowley went on to say, today in Trinidad and Tobago, we have a population that is running scared. He went on to say, I woke up yesterday and people were telling me to press the panic button. I am sorry it has come to coffins and the faces of dead people to realize that we have always been in a difficult place. But today, there is no longer consensus among the business groups that a state of emergency is necessary. The Tobago Chamber of Industry and Commerce has rejected the government's proposed plan to extend the emergency by 3 months. The Chamber's president, Diane Haddad, said that the organization does not see the need to extend a state of emergency. She said, the fact is we don't know that the lockdown is serving any purpose other than stifling people and frustrating people who have been locked in for a very long time. She went on to say, you are opening up the economy, but you still want to keep us in a state of emergency for 3 months. It does not serve any meaningful purpose. Come out of the mole and let us get back to life as normal. She went on to say, the state of emergency needs to be released at this time. So not even the business community is in consensus that a state of emergency is necessary any longer, as circumstances have changed from May 2021. What is the scientific rationale that the government is using for the continuation of the state of emergency? That is the question. My next point is regards to schools and reopening. In May 2021, when we were facing the upward climb of the surge of the coronavirus, in addition to the state of emergency and curfew, all face-to-face classes in secondary schools were stopped. Pupils that were scheduled to write their CSEC and CXA exams were up until then allowed to be in physical classes in preparation for the examinations. The Prime Minister went on to say, this is not in comparison to another state of emergency. This particular situation calls for this, and the length of time will be determined by the response that we get. I am saying the more cooperative the response, the shorter will be the period. Now, this is what the Prime Minister said in May of 2021. Skip forward today to the present day, where we have reservations by many parents in vaccinating their children at this time. The Education Minister, Dr. Nyan Gatsby-Dolly, said both vaccinated and unvaccinated students will be welcomed back into schools next month. So the Prime Minister has restarted schools. He has restarted the school system. Students in Forms 4, Form 5 and Form 6 will be allowed to resume physical classes when the new academic term starts in September 6th of next month. Dr. Gatsby-Dolly also said that the vaccinated and the unvaccinated have to coexist and there is no requirement for separation. Schools are not expected to operate differently than any other society in the country. So what is really the issue? The question is it safe for our children to return to the classroom? And why is the government trying to convince us that a state of emergency is necessary for the next 3 months? Is there something that they know that we do not know? Is it truly safe for our kids to return to the class? These are the questions that need to be answered. My next point is regards to the parallel healthcare capacity. In May of 2021, there was a major consideration that our parallel healthcare capacity was at its brink and may collapse. Dr. Mariam Abdul Richards, Principal Medical Officer of Institutions at the Ministry of Health, noted at the time that more people were being admitted into hospital daily than being discharged. She went on to say on the 15th of May that 95% of beds in the high dependency unit were being occupied, as well as there was no space in the intensive care unit as all the beds were filled. She went on to say that in previous conversations at the time, they were speaking about 10 days and 5 days and 7 days left before the health system would be overwhelmed, and it would no longer be 5 days. It was currently touch and go at that time. The increasing hospitalization level was a cause for concern because the rate of growth of the coronavirus at the time was, what it meant is that hospital beds were insufficient for use. People were not getting the best care that was possible. The same day that Dr. Abdul Richard said this, the Ministry of Health announced 520 new COVID-19 cases. Dr. Avery Hines, also of the Ministry of Health, reported that 43 out of every 100 persons tested in this country were returning positive results for the coronavirus. So the issue at the time was that the parallel healthcare system was running out of beds. Persons were not getting the best possible care because of this. The large number of admissions continued to exceed the number of discharges at the time. There was a net increase in the daily number of patients warded at the nation's hospitals. Between 30 to 50 patients extra were being admitted daily. Due to the climbing numbers, the Ministry of Health increased the number of beds by opening additional facilities around the country, as well as medical tents that were donated by the United States of America were being used to see patients. Minister Terence Dialsing at the time said that he hoped to rally out the next 2 weeks. It was a dire situation. As I said, the signs were ominous. The country recorded its highest daily COVID-19 death toll since the pandemic began just days before the 15th of May, in which 21 persons died. In the first 13 days of May, 87 persons died of COVID-19. We were on the upward trajectory of the COVID-19 curve. Our citizens were dying in droves. Of the 21 victims that day, 5 were elderly women and 4 were elderly men with comorbidities. 1 was an elderly woman and 1 was an elderly man without comorbidities. 3 middle-aged women died and 1 middle-aged man died with comorbidities. And it goes on and on. At present, we are still losing persons to COVID-19, but the state of emergency, while the economy is being reopened, does not make sense. It is either we are going into a lockdown or we are opening up. Which one is it? My friends, we also have to look at the situation with the availability of vaccines that we had at the time and vaccine procurement. In May 2021, the only vaccine that we had here in Trinidad and Tobago was the Oxford AstraZeneca vaccine, of which around 60,000 of our citizens had received the first dose, and the number of citizens who had received their 2 doses was 1,179. So at the time we had less than 1% of our population vaccinated by a WHO certified vaccine. So at the time, vaccine availability was a hindrance to Dr. Rowley and his administration, as he had refused to pre-order vaccines in October 2020 when funds were allocated for vaccine procurement in the national budget. Dr. Rowley went on at the time to say, "We want to purchase vaccines, but they are not available to us. It is not that we have the vaccines and we are not using it. It is that vaccines are available and we are not getting them. The availability of vaccines is part of the problem of the response." So that is what he said in May of 2021. He said that conversations were on the way with the United States to get donations, but US policy on vaccine distribution was that the US government had to vaccinate its own population first before donations could be made. He went on to say that the majority of vaccines that are currently in the Caribbean were those that were gifted by other countries such as India, and without these gifts, Caribbean countries would not have had a single vaccine up until April of 2021. But moving on to today, as of last Friday, 472,000 citizens of Trinidad and Tobago have received their first dose of the vaccine, while 355,000 are fully vaccinated with a second dose. So we have around 60% of our population that has gotten at least one dose of the COVID-19 vaccine. On last Friday, we vaccinated over 15,000 persons in one day. We currently have hundreds of thousands of doses of the Sinopharm vaccine available. We have over 270,000 doses of the Oxford AstraZeneca vaccine available. We have over 300,000 doses of the Pfizer vaccine available, and more to come in 2 other tranches, as well as we have received recently over 100,000 doses of the Johnson & Johnson vaccine. So the question must be asked, why does the government keep on insisting that they are following the science, yet the data shows that we are in a very different position than we were in May of 2021? And why is Dr. Rowley justifying a state of emergency when all the facts that he had at the time are not the same as now? We have roughly vaccinated, we can roughly vaccinate 40% of our population by this week or next week. And by vaccinating those in the age group of 12 to 18, we can vaccinate another 100,000 persons. So we are approaching roughly 50% of the population being vaccinated. So a sizable proportion of our population is vaccinated. Is it that we as a nation are being punished for those that are vaccine hesitant? And I refer back to what Dr. Rowley said in May of 2021. He said that the length of the state of emergency will be determined by the response that we get. And what he said is that the more cooperative the response, the shorter the SOE period will be. So we have almost 500,000 citizens in Trinidad and Tobago receiving one dose of the COVID-19 vaccine, and yet we are still going to extend the state of emergency for another 3 months. My friends, vaccine hesitancy is an issue that we currently have, and the Member of Parliament for Tobago West, Shampa Kojo, it has been reported saying that many Tobagonians in her constituency are not being vaccinated with the coronavirus vaccine, and Tobagonians were not serious about taking the vaccine. What she said is that she literally went from house to house, and she's having a problem of getting people vaccinated, and people are just hesitant. They don't care to be educated about it, and they don't want to know. She described the situation as very serious. According to reports by Dr. Roxanne Mitchell, General Manager of Primary Healthcare Services in the Tobago Regional Health Authority, there has been a 50% decline in the number of persons being vaccinated in Tobago. And what she went on to say is that it's not only slowing in Tobago, but nationally as well. She said that at one point they were doing up to 600 doses of the COVID-19 vaccine in Tobago, and it's now down to 300 doses. There's also the issue of elderly homes, and Dr. Mitchell said that roughly 42% of residents in Tobago have been vaccinated, but that also means that the rest have not been. And this is despite the pleas of the Minister of Health, Terence Dialsing, for the guardians of these residents to sign consent forms for the elderly to receive their jabs. And it's not only those in the elderly homes that have issues with vaccination. In terms of healthcare workers, Dr. Mitchell went on to say that 53% of healthcare workers, both in the private and the public sectors, have been vaccinated. So that means 47% of these persons in this industry are not vaccinated currently. We have hundreds of thousands of vaccines in our hands, but they have a shelf life. How are we going to get these vaccines in the arms of these persons? So my friends, we have done everything that we were asked to do as a population. They asked us to wear masks, and we wore masks. They asked us not to go to beaches and rivers. We did not go to the beaches and rivers. They asked us to shelter in place, and we did just that. So now that we have gone through a state of emergency for 3 months, the government is now telling us that they want another 3 months of the same state of emergency to do what exactly? They had months to prepare for the arrival of these vaccines, and now that they have them in hand, they do not know what to do with them. Where was the public health education campaign for the man on the ground 6 months ago, explaining why vaccines are important and safe and necessary? We need a coalition of interests to bring this message home. How exactly will an additional 3 months of this state of emergency help those who are hesitant to get vaccinated? What will be our position after 3 months when we are not at herd immunity? How much longer can we pay for this government's incompetence with our lives and livelihoods? So the state of emergency has succeeded in one thing and one thing alone, and that is destroying thousands of jobs in small and middle income businesses. Lives and livelihoods are one of the same, as our political leader has said. There is no justification in continuing to curtail people's rights while destroying their jobs. This draconian measure must be abandoned, and it must be abandoned now, and common sense must prevail. We must focus on vaccination, not on a state of emergency and taking away one's rights. To return to a level of normalcy here in Trinidad and Tobago, a state of emergency is not a tool that can be used at the whim and fancy of those in government. I thank you, and we'll now move on to Senator Jayanti Lakshmidhyal.
So good morning again, everyone. Just to follow on with some of the points that Dr. Sitran has raised, you know, if you have power but you have no accountability, that can really spell the death of democracy in any country. And the government is on record as saying that the Constitution permits them to come to the Parliament by way of a simple majority and extend the state of emergency for another 3-month period. And that is true. But you do not exercise power as constitutional power with something as important as a state of emergency, which is an incursion upon the rights and freedoms of the citizens of this country, simply because you have the power. You must be accountable to the population with how you are exercising that power, the reasons why you are finding it necessary to exercise such an important power at this point in time. As Dr. Sitran said, we must critically examine the circumstances that existed when the state of emergency was first implemented on the 15th of May of this year, and what our situation is right now. Pursuant to Section 9 of the Constitution, the President delivered a statement to the Parliament outlining all of the reasons and some of the factors, or all of the factors that would have weighed upon the decision to announce the state of emergency back in May. And these factors really focused on the fact that we had the entry of the Brazilian variant at that time. We had the virus being recording cases of positive cases amongst different demographics. We did not have the availability of vaccines that we, as Dr. Sitran detailed, that we have now. And of course, our parallel healthcare system was under severe pressure and on the verge of collapse. We must look then at what existed, what they have done in the last 3 months or 3.5 months, because it was 15 days and then an extension for 3 months, which took effect at the end of May. And then we must also ask the question, and we are calling upon the government to provide us with the information as to what they intend to do for the next 3 months if they intend to pass and bring the state of emergency. We know that it is a simple majority which they have, and therefore they can do this. So assuming that they do it and that they bring this additional 3-month period on board, despite the objections, despite all of the calls that are coming from various sectors of society, this government doesn't have a track record of listening to what the population has to say many times, and certainly not what the opposition has to say. So let us assume that they are going to extend this. We are saying very clearly today, it is absolutely necessary for them to give the population information as to what they hope to accomplish in the next 3 months if they are going to pass this motion to extend the state of emergency. If you look at the accomplishments of the last 3 months, what are those accomplishments? 27,000 new cases, as Dr. Sitran said, from 15,899 on the 15th of May to 42,962 today. Under a state of emergency, we had more infections, more people being infected with COVID than we had in the first 14 months of this pandemic. The death rate, similarly, we moved from 285 to 1219, I think it is now. 934 citizens died whilst we are under a state of emergency. the death rate, the amount of deaths that we have experienced in this 3.5 month period of an SOE tripled compared to the initial 14 months that we have been in this pandemic. The entry of variants. At the time that the state of emergency was called, it was the entry of the Brazilian variant. Has the state of emergency prevented other variants from entering the country? We know now that that has not been an effective measure against keeping variants out. We have tested persons here with who have tested positive with the Delta variant. So, and of course, I think the greatest fatality we have experienced is that of our economy. Our economy, and particularly what we call the MSME, the micro, small to medium enterprise sector, has really seen its death. Now, doing nothing is like the default mode of this government. And to simply come and say that the Constitution permits us to extend the state of emergency for another 3 months, that is a cop-out. That is a poor excuse, and it really goes along with what we have been seeing all along through this pandemic, that they will do something simply to say that they are doing something, but the effectiveness cannot be demonstrated. And as I've just run through the statistics, and as Dr. Sicharan has gone through as well, what have we been seeing? Nowhere has the government demonstrated the effectiveness of its measures. We have moved from the amount of persons being vaccinated, but that has nothing to do with the state of emergency. The state of emergency didn't help us get people vaccinated. Getting the vaccines is what helped us get people vaccinated. So right now we are somewhere around 25% of the population fully vaccinated, and they are saying that they want more time for a state of emergency to get people vaccinated. Well, tell us then, how does the state of emergency help you get people to take the vaccine? How is the state of emergency helping increase the amount of vaccines in arms? Explain that to the population and justify this extension that you want to get. When we look at other Caribbean countries, we are still behind countries like St. Kitts and Barbados and Antigua with respect to the percentage of our population that's vaccinated. And this had nothing to do with the state of emergency. It had to do with the mismanagement of vaccine acquisition, which the government bears the sole responsibility for. Dominica has about the same percentage of the population vaccinated as we have, roughly about 25%. But Dominica has had 1 death. Their death per million, when that's one of the measurements that's being used when what you look at is your death rate. We have 865 deaths per million. Jamaica only has 455, and they only have 4.7% of their population fully vaccinated. So when you look at the statistics and the data that is out there, this problem goes far beyond how many people you can vaccinate and putting restrictions on the rights and freedoms of individuals. Because you have other countries who have opened up their economy long before us. You have other countries that have done things very differently, and the results are showing. And so it really, it is absolutely necessary for the government to take a holistic view, as we say, to balance the lives and the livelihoods, and to probably deploy different measures to bring us out of this pandemic, and to not simply focus on lockdown, lockdown, lockdown. That is default mode. That is the easy response, and it is the quickest and easiest response. It is the easiest way for them to do something. But is it really being effective? Quarantining our fundamental rights and freedoms is not going to solve the problem that we have with the pandemic. And that is obvious from what has taken place in the last 3 months. If you say you want to follow the science now suggests that the new normal is learning to live with the virus and all the different strains that can evolve and enter the country, as opposed to staying in a perpetual state of semi-lockdown. When you are in a state of semi-lockdown, as we have been, the numbers aren't actually accurate. The numbers give a false impression that because they are suppressed, because you have restriction on movement, but that is unsustainable. And therefore, you have to have different strategies in place to reduce the rate of infection. It is the combination of other measures which can be sustained that will bring a long-term balanced result, balancing the need to preserve lives and balancing the need to open up the economy and allow people to exercise their rights and freedoms. You have to have government accountability when it comes to implementing measures like this, because it is essential to ensure that it is a legitimate aim that is being pursued, and that this doesn't degenerate into some just arbitrary interference with the rights and freedoms. When you look at our Constitution and the exception, that's a word that is used. It is an exception for special circumstances when you have a state of emergency. And what is accepted? The exception is to the rights and freedoms that people enjoy every day. So it is not simply something that can be done like that, and because you have the power, you do it. it really must be in exceptional circumstances that you want to exercise this type of power, because you are essentially taking away the enshrined rights of people that exist in our constitution. It is the foundation of our democracy, and if you want to interfere with that, you must be very certain that you are pursuing a legitimate aim, and that it is the measures that are being rolled out are not disconnected from that aim, and that they are being done properly, and that they are producing results. Now, what are the problems that we face now that the SOE can help? Firstly, I think the government needs to come out and say, what is the magic number for vaccination, and what is your target before you can feel comfortable with lifting an SOE? You are not comfortable at this point in time with saying that we must lift the SOE even though you're opening up the economy. Those two things seem to be very contradictory in the minds of many citizens, and it's a concern that has been raised across the board. So what is the magic number of vaccinations that you want to see before you can say that we can come out of a state of emergency and you can relax the restrictions on fundamental rights and freedoms? You owe it to the population to tell us that. What is the target? As Dr. Citron said, what are the strategies that you are going to deploy in the next 3 months that you haven't yet done? And why haven't you done it? Why haven't you had a more aggressive campaign to address vaccine hesitancy? That should have started at the beginning of the year when we knew the vaccines were coming. But again, doing nothing seems like the default mode. You sit and you wait and you wait and you wait and you wait, and you have mismanaged vaccine acquisition, and now that the vaccines are actually here, you cannot get it rolled out properly. So the rollout of the vaccine program has been a problem, as we saw the crowding and so on. Down to this week, the opposition had to lobby heavily to have more vaccine sites available in some of the rural areas, and areas which were, when they announced the sites for the vaccination of children particularly, there were large areas that were just underserved, and these were large portions of the population. Why is it so difficult for the government to understand that you need to reach the people? Calling people foolish and buffing them and telling them that they are going to stay in an SOE until we get vaccinated is not the way. We want to see better communication. We want to see a government that shows that they are addressing the concerns. I have seen information being put out in other countries with respect to how many people are in HDU, ICU, and how many deaths, and how many of those people in those categories were vaccinated and unvaccinated. When you have data presented in a manner like that, you would be more convincing than buffing people every Saturday from a pulpit through a press conference. And that is how we want to see things going forward right now. Simply calling an extended SOE for another 3 months is not going to encourage people to take the vaccine. Now, the other thing is that if it is that you are extending this SOE and you have signaled your intention to do so, what are your plans for the economy? You have come out, I think it was the Ministry of Trade came out in response to a statement from the joint body that represents industry and commerce, and they said that look, they don't agree with that data, that 6,000 retail businesses are facing closure and may never reopen. Where is your data? I want to ask the government, where is your data on the accurate amount of job losses, on business closures, and so on? And you cannot simply stick your head in the sand and deny something unless you have the actual data and figures to present to us. And more than that, don't just present the data, but tell us, how are you going to address these concerns? Staying in lockdown may only result in the further hardship and poverty for our population. So what measures are you going to employ differently? I think it is embarrassing that the government could actually say that they have spent $5 billion on this COVID pandemic, and we still see so much poverty and hardship around us. I think it is embarrassing for our government to come and say that they have paid 4,000 salary relief grants and 14,000 more are waiting. What do you expect those 14,000 people to do? You are calling upon those 14,000 people who are applying who have no salary. And we very well know, this is not no high science. We know that the persons who apply for these grants are people who were in the lower paying jobs and who have lost their jobs due to the closure of certain sectors like bars and restaurants and casinos and so on. These are not people who have a nest egg sitting there and investments that they can rely on and income, on various streams of income. These are the most vulnerable people in our society. and you are still sitting there saying that you have not processed some of these salary relief grants, and there's no indication from the government as to when these people can expect to get some relief from you. You are asking these people to get their children vaccinated and send them to school. Have you asked the question whether they are in a position to send their children to school financially? Have you put things in place to address those things? How is keeping the country in a state of lockdown for 3 more months going to address these very legitimate concerns? And I want to end by saying there are many different things that the government can do and that they can say and that they can implement that does not require a state of emergency. For one, ramping up the testing. We know every day when we look at the numbers, those of us who critically examine these press releases, that the number of infections every day fluctuates. It's roughly around an average of 200 per day now, but sometimes it's because of the range of days of testing and how much testing is being done. We need consistent testing, and I have pointed out that the testing for variants, particularly when the Brazilian variant came about, we asked the question in the parliament about testing for the variants, and there was a very limited capacity. What have you done in the last 3 months since calling the state of emergency to increase our ability to test for variants? Because we know that the Delta variant can spread faster and can have more severe effects on people. So what have you done to increase that capacity through UE and CARFA for the testing? What is the criteria for testing positive cases now for the Delta variant? What have you done to improve and to make our parallel healthcare system more robust in the event that there's a third variant entering our shores that causes another outbreak? Have you really devoted the resources, and have you critically examined the medical management of patients? At the end of the day, it may not be possible to curb or to suppress infections completely, but if you have better medical management of home quarantined persons, you would have less persons coming into the healthcare system. And if you have better management of persons in the healthcare system who do get severely ill and need to be placed in an ICU and on a ventilator, then you will have a lower death rate. So have you really addressed your mind? I think Dr. Gopi Singh has spoken very much about this topic and about the need for assistance and to look at and to critically, he has called for an inquiry into the number of deaths we've had, because it has been exceptionally high in terms of the number of people dying in the hospitals. Do we need to look at our medical management? You do not need a state of emergency to do that. We want to look at, as well, as I said, a better strategy for the vaccination program. Do you need to go out into the communities more? Do you need a better communication program? Do you need better education through the schools, through the churches? Do you need to reach out to leaders in this country? And again, the final thing that I think is very, very important for people to be comfortable with further restrictions, even if they do have to exist in some form or fashion, whether it is through public health regulations or through a state of emergency, is you must have a solid economic plan to alleviate the hardship and the suffering being faced by the population at this point in time. Mr. Faria, I think in his statement, made the point that with the curfew in particular, you are actually, and I find it most counterproductive when he put it this way, that when you have businesses now with a curfew operating with shorter hours, you actually have more crowding. That is exactly what you don't want. So your curfew is actually causing more people to have to be in retail businesses during the hours that they are allowed to open, because businesses are opening for shorter periods of time. And he also mentioned something that, factories which would have worked on a 2-shift system are no longer able to do that because of the curfew. And so you have less productivity coming out of our manufacturing sector. This is counterproductive to us trying to have an economic recovery for this country. So the government really, you cannot simply say, I have this power and I'm going to exercise it because I want to see more people vaccinated. That makes absolutely no sense. You owe it to the population to really say how you are going to manage this thing going forward if you intend to pursue it. And I think it is incumbent upon the government to demonstrate that they have had any measure of success, because as both of us here this morning have examined the facts and figures, we have not seen any real measure of success that warrants the continuation of this state of emergency. So thank you very much, and I think we'll take some questions now.
So you had mentioned found that if it was safe, so most of my questions center on vaccine hesitancy. You had said, you had asked if the government was sure that it was safe to send our children to school. Would it not then benefit everyone if, from both sides of the aisle, people encouraged parents to send to get their children vaccinated as well as be vaccinated themselves?
Well, the opposition has always, we have been encouraging people to take the vaccine, but at the end of the day, telling people take the vaccine will only take you so far. If people have legitimate concerns about medical concerns, and some people may have religious concerns and so on, then you have to engage with people and you have to listen to their concerns. The government, this is a time for leadership, and the government is in charge of the vaccine rollout program, and they must take that leadership step to engage with the population. We have heard that certain religious groups have concerns. What has the government done to date to meet with those groups and really try to understand the concern and to address it? I think that there's a group of parents who also have concerns with respect to the vaccine and the safety and so on. When people organize themselves into a group like that, they're basically making it easy for you. You don't have to go by everybody's doorstep and talk to them. There's a group of people that you can engage with. So you have to engage with people, and you cannot simply dismiss people. That dismissive attitude is probably what is causing and contributing to the vaccine hesitancy, the dismissive attitude of the government. They have to really listen to the concern and find a way to address it, and to perhaps work around and work with people to get them to accept that the vaccines are safe. And in certain cases where people have medical concerns in particular, I think it is incumbent upon the Ministry of Health to put more information out there that would help address these particular circumstances and so on going forward.
And if I may, the vaccine that we use in children ages 12 to 18 is the Pfizer vaccine, and it is currently on emergency use listing under the FDA and the WHO. But early next week or sometime next week, it is what is thought is that it will become fully recognized by the FDA, in which case the WHO will then recognize it as a fully fledged vaccine with full approval, so it will no longer be emergency use listing. And what this means is that some persons like to say it's an experimental vaccine, and well, no, it was first listed as emergency use, meaning that the advantages outweighed the disadvantages. And because so many millions of the vaccine has been used now, and enough studies have been done on the vaccine, it is getting full approval by the FDA sometime. And we in the opposition have always been pro-vaccination. I myself have been an advocate for vaccine procurement since the start, and we advise everyone to go out and get a vaccine.
I made this point recently in another forum, and I think it's worth reiterating. The way that you disseminate information goes a long way. And I had noted in the UK, where there are concerns about side effects and so on and the safety of the vaccine, they put out a listing of the numbers, the statistics to show how many people took each brand of vaccine. They then gave a breakdown of all the different side effects and how many people suffered from those side effects, including death, but they included things like heart attack, stroke, and so on that might have been experienced subsequent. And when you look at those numbers, and it really puts things into perspective, because you see how small, when you look at the number of people taking the vaccine, you see how small the probability is. If that's the correct word, it's a scientific thing, but yeah. It basically says that, look, if 100 planes take off, they don't make news, but the one plane that crashed will make the news, and that is sometimes what people focus on. And that is what we have happening here, that people are sometimes getting scared, and they have a legitimate fear that they may suffer some sort of side effect. But the government, if they put, these things don't need to be shrouded in secrecy, let them be open and transparent and explain to the population what's the likelihood that you may suffer a side effect as a result of taking a particular brand of vaccine, because as you know, there are certain concerns with different brands and so on. And that might give people some comfort to say that, look, the likelihood, the odds, what are the odds? It's like you're more likely to, I don't know, get struck by lightning or something like that. And that's the type of conversation that we need to see happening in order to address the issue of vaccine hesitancy. And as I said, not a Saturday afternoon buff for the population. That doesn't take us any further.
And also, just to add to that, it's who gives the message, we have these very well qualified doctors giving the scientific message every week or bi-weekly, and it's very scientific, and in my opinion, not many in the population would understand everything that they say and how they say it. So it's who gives the message. We need to get more entertainers involved, more high-profile persons, exactly, religious leaders, church leaders.
We've had quite a few religious leaders.
Yeah. And I mean, more needs to be done because the general guy on the street, he needs to understand that this is a safe way to prevent death and injury to yourself as well as to others in the community, and this is the way that we get back to normal.
I think my final question would be, you had spoken about how the sectors are reopening, which they've been doing, thankfully. But an issue that I observed was also congregation before the curfew was put in, especially around the areas that are now marked off. Especially we used to walk through like Independence Square on an evening, and you would see these large numbers of people all close together, etc., etc. Do you think if the restrictions are lifted, do you think people will go back to those kinds of what does normalcy for a lot of people? Do you think people will go back to that, or do you think they will think that COVID is still around? We should shelter in place?
Well, I think that, we're not back to shelter in place because, of course, we're reopening businesses. People have to go to work. If you want to reopen schools, people have to go to school and so on. We're just speaking about people congregating on the streets. I mean, I don't know about that. Whether people would or wouldn't. But that's a question of enforcement. You can have, apart from the medical intervention like vaccinations, you have these non-medical interventions, which we've had in place through the public health regulations, and it might just be a question of enforcing it. Do you need a state of emergency to ask people to socially distance? Did you need a state of emergency to cut down on the capacity of public transportation? We didn't. We had that before. In fact, and I think the opposition leader raised this last week with respect to the discrepancies in the regulations and how many times they were amended and how difficult it is for people to even understand. Some people still aren't even sure if we have restrictions in terms of the capacity of persons that can be in a particular sector. So what she was explaining, and I think this is an excellent point, is that with the reopening of the retail sector, do you want to have a comprehensive regulation and in place and that restricts how many people can be, like, let's say, your capacity in a supermarket and so on? It takes us back to the point as well that sometimes what you're doing is actually counterproductive, because having an SOE and a curfew in place, you might actually be restricting the opening hours for businesses, and more people have to congregate, or more people are trying to be in the same place at the same time as opposed to longer hours. Why we can't have nighttime vaccination so that we have less congregating at health centers and at the vaccination sites? Wouldn't that be more amenable? You might actually find people who find it challenging to do certain things during the day, being happy to do it later on in the night when there are less people around and so on. So I don't know that it is automatic that if an SOE is lifted, you're going to have people congregating. That is a question of enforcement. We have a tendency, again, here, I think it is part of that appearance of doing something, but you're really doing nothing, being the default mode. Calling a state of emergency and having one on the books doesn't do anything if you don't have proper enforcement. So regardless, SOE or no SOE, you must enforce the public health guidelines and regulations. And so restricting the fundamental rights and freedoms that are guaranteed by the Constitution, is that really necessary and essential in order to enforce public health guidelines and best practices? I don't think it is. And if the government seems that is the only way that they can do so, well, they must justify that and give us the explanation as to why that is the only mechanism that they can use to do so.
As well, the coronavirus is something that we will eventually have to learn to live with. And we have seen in very highly vaccinated countries such as Israel, which is one of the highest vaccinated countries in the world, and they have a surge in coronavirus cases. So vaccination is a tool that we would use to fight the coronavirus, and it would prevent death, it would prevent hospitalization. But learning to live with the coronavirus in our communities and in our country, and we have to get back to some level of normalcy and to return the economy to normal and get everything start going again. The wheels of the economy have to start turning, and the state of emergency really is not justified for an extension at this point in time. There is no real scientific basis for it, and we are saying that we do not support it.
Any other questions? Okay. Cool. That's it. Okay. Well, thank you very much for joining us again today, and we look forward to hearing more feedback from the public, and of course as I said, we've raised these concerns. Parliament will be sitting on Wednesday for the debate of this motion, and the opposition will again bring forward its views and perspectives on this SOE at that time. So thank you for joining us.
Thank you.